The diagnosis of leukemia is always something terrible. It's such a bad experience, and as a patient, you feel totally distressed but also lost, because irrespective of the level of knowledge you may have previously, I think the complexity of leukemia and the treatment procedures will make you feel totally desperate. However, I think there's nothing hopeless, and it's really important to get engaged in the cycle of your treatment, to really go and seek and try to understand. You don't need to be highly knowledgeable in hematology. There are some basic principles, very simple. Leukemia, what is it? You have bone marrow. This is a factory that's making your blood cells. Some of them are becoming nasty and they're annoying the others. Try to understand these simple things. Try to communicate. And if you don't ask, you'll never get an answer. So there's no risk for asking. And at some point, you will be able to integrate maximum number of information. And once you have all of these information available, you are going to be able to feel probably more relaxed, but also to communicate smoothly with your doctor, with all other healthcare professionals. When it comes to discussions with your doctors, with your nurses, with other healthcare providers, I think it's important to ask all questions. Whenever you feel there is something you don't understand, there is something to clarify, you need to ask the questions. There is no right or wrong questions. Probably there are sometimes wrong answers, but the questions are always relevant if you put them in the context when you ask them. So it's really crucial that you ask as much as you can question, because you need to feel comfortable at the end of the day with all the huge amount of information you're going to receive. And if you want to digest this information, you need to have all available data, all available information to try to make your way through the leukemia journey. Even if you feel very strong as a patient, even if you have a biography of someone very active, very wise, I think during a diagnosis of leukemia, you need to rely on some support. It's a very difficult, tough moment. You should not take this journey alone. Please don't hesitate to embark the family, the patient support. There are wonderful, great people all around you, just sitting there and willing to help. Of course, you can modulate the level of help you would like to have, but definitely don't stay alone. It's a big mistake.